If you've been told that all your labs and tests are normal, but you don't feel normal, then this video is for you. So what I mean is that the labs and testing that we get in conventional medicine setting, be it our visit to a primary care provider or a specialist, they may come back normal. Meanwhile, you have certain symptoms, for example, migraine, arthritis, chronic fatigue, persistent skin rash, or chronic bloating, but all your labs are fine, or perhaps just slightly off. So you and your provider are stuck because neither one of you knows what causes your symptoms. And because of that, your provider doesn't know how to help you, doesn't know how to treat you. And you've probably heard the phrase, all disease begins in the gut. But what does it actually mean? And more importantly, how do we measure it? How do we measure gut functionality? So today we will walk through a comprehensive functional medicine stool test, and we will look how it assesses our gut function. And this isn't just about finding a specific bug or specific bacteria. It's about understanding gut microbiome, digestion, inflammation, and of course, immune function. And most importantly, what do we do about it? Unfortunately, this scientific test is not routinely used in an everyday clinic, but I think that it should. So let's discuss that and go over it step by step. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. Let's start with good bacteria. The gut microbiome is a complex ecosystem, and it houses good, bad, and opportunistic bacteria. So first we will analyze beneficial or good commensal bacteria. And I'll throw some names such as bifidobacterium, lactobacillus, akkermansia, and many more. So the question is, are they present in optimal ranges for this specific patient, for this specific person? And I have to say that these organisms, they play critical roles in mucosal integrity. Mucosal integrity is how strong your gut lining is and how it protects you from the toxins and outside invaders, outside infections. These good bacteria are also very important in production of short-chain fatty acids, and those short-chain fatty acids are crucial for fiber absorption. Another function of these beneficial bacteria is that they are vital for, you guessed it, your immune health. And as I always say to our new patients, 60 to 70% of your body immunity resides in the gut. So now we're actually looking at the root component of your immunity. The test evaluates the type of beneficial bacteria and their quantity. Is something lacking? Does it have to be replaced? And to jump ahead, I do have to say that I choose probiotics based on this component of the gut test. Then we have opportunistic bacteria. So these bacterial species are normally present in small amounts, but they can become pathogenic. They can become bad when they're overgrown. And again, some of them, the names, Citrobacter, Klebsiella, Proteus, Morganella, among others. And these are not good bacteria, but I do have to point out that bacterial overgrowth is not a bacterial infection. It's still not a good thing, but it's not a full-blown bacterial infection. It's one of these subtle findings that can cause many bad symptoms, from abdominal pain, bloating, cramping, to skin issues, migraines, arthritis exacerbation, and many more. So specifically on the local level, on the gut level, bacterial overgrowth in small intestine specifically can lead to gas, bloating, and nutrient malabsorption. But as I just mentioned, systemically, meaning whole body, it can lead to many other symptoms that are not gastrointestinal. And while this test isn't specific for SIBO, that is a small intestinal bacterial overgrowth, it can raise suspicion when certain patterns on this test are suggested. So next we have pathogenic bacteria. And this is bad bacteria. So we assess for virulent strains. strains that are known to cause acute or chronic GI infections. Those are real infections. And they include these bacteria, Clostridium difficile, toxins A and B included, Salmonella, Shigella, Campylobacter. So now we're talking about obvious infection. It's not just overgrowth. And most of our patients are negative for acute infections, thankfully. And this is actually something that usually has been tested because it is tested at the local hospital lab. And the key here is that evaluation of subclinical colonization of these organisms that only occurs in a functional testing. So these colonizations can perpetuate low-grade inflammation and mucosal damage, and they create a chronic inflammatory state. So when people come to our clinic and they say, I feel that I have inflammation, actually sometimes they're right, because sometimes we do find types of bacteria that could be the culprit for this inflammation. So just to make it clear, infection is when you have a certain high number, a threshold of bad bacteria, and it's usually checked for and diagnosed at your local hospital lab. The symptoms of infection are usually acute and dramatic, with diarrhea, abdominal pain, occasional bleeding, even fever, chills, and all of that can escalate into sepsis. In contrast with colonization with bad bacteria, you could have this smoldering bad bacteria that may result in some GI symptoms, such as chronic diarrhea or cramping, or not. You may have a chronic brain fog, or arthritis, or headaches, or skin rashes, and that is why it is so hard to get to the cause of some of these symptoms, because they are not gastrointestinal in their manifestation, but they may be gastrointestinal in their root cause. So next, we will look at parasites. And again, some of the common ones: Giardia, Lamblia, Entamoeba histolytica, and protozoa. Protozoa are one-cell parasites, and like some of them are Blastocystis hominis or Entamoeba fragilis. While often they're asymptomatic, these organisms can trigger IBS-like symptoms. They can trigger fatigue, immune dysregulation, especially in already immune suppressed or somewhat susceptible individuals. One of the most common parasites that we see in the US is Blastocystis hominis, and those are protozoa, which means again a one-cell parasite. Unfortunately, it's not routinely checked for at the local hospital lab. And there are some discussions, some arguments amongst the clinicians whether this parasite should be treated if it is asymptomatic. So in our clinic, we always address it, but of course we address it on a personalized level. So we address it differently depending on the patient. If the patient is very symptomatic, has many symptoms, GI or non-GI symptoms, then our treatment is more aggressive. And if there are minimal symptoms, then of course they still get a functional medicine protocol with herbal, natural, antimicrobial supplements that are geared towards this protozoa treatment. The next gut test checklist is viruses. And though not commonly considered in chronic gut dysfunction, gut viruses such as norovirus and adenovirus are screened. They are present on a functional gut test. Acute infections may present with diarrhea, but chronic viral exposure could play a role in gut barrier disruption and in immune imbalance in general. And these viral infections actually are relatively uncommon. So usually on most tests, they are negative. However, something else is very common in the gut, and we see it a lot, and it can create havoc in our whole body, and that is fungi and yeast. So fungal organisms, particularly Candida species, are assessed to determine whether there is overgrowth of fungus in the gut. And interestingly, fungal dysbiosis is often linked with sugar cravings. It's almost like when you eat a donut, you're trying to satisfy your gut fungus. So gut candida is actually a very big topic. But to summarize here, I would like to say that chronic candida overgrowth in the gut has been linked to a wide range of conditions due to its impact on everything, on inflammation, immune activation, and intestinal permeability. And it can contribute to digestive issues like IBS, bloating, and leaky gut, and also skin disorders, very common, such as eczema, psoriasis, and rashes, and also neurological symptoms that include brain fog and anxiety and fatigue. I actually go in much more detail about it in my book that is titled The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. And I actually have the link in the description. So interestingly, Candida overgrowth may also play a role in autoimmune diseases such as Hashimoto's thyroiditis and rheumatoid arthritis. It also plays a role in hormonal imbalances, including PCOS and estrogen dominance, and in metabolic disturbances like insulin resistance. So it's also related to a metabolic syndrome. Additionally, it's associated with, no surprise here, recurrent yeast infections, histamine intolerance, and chronic immune dysregulation. Why is the effect of Candida so vast? These systemic effects often stem from fungal toxins, from immune reactions that they cause, and also Candida's ability to disrupt normal processes in the gut and liver. Next, we move on to another bug that stands out in the damage that it can cause, and that is Helicobacter pylori or H. pylori. It's a spiral-shaped bacterium that colonizes the stomach lining. Beyond ulcers and reflux, H. pylori can interfere with stomach acid production and lead to downstream maldigestion and microbiome imbalances. H. pylori is somewhat similar to Candida as it can cause a wide variety of both GI and non-GI symptoms that are hard to trace. The gut test evaluates not just specifically for H. pylori organism itself, but also for virulence factors or markers that helps us understand how aggressive the strain may be, as there are multiple strains of these bacteria. So now we switch gears to move to next section of the test that focuses on digestive enzymes and absorption markers. Obviously, proper digestion is fundamental. So we do look at the pancreas. So we assess pancreatic elastase. That's a marker of pancreatic enzyme output. Low levels may suggest exocrine pancreatic insufficiency, meaning that your pancreas is not working at its capacity, or in other words, you have a sluggish pancreas. And that is different from the endocrine function of the pancreas that is responsible for insulin production. Exocrine insufficiency is common in chronic GI inflammation, in SIBO, and actually we see that just with aging. So also, we assess fat absorption that's related to pancreas. What is that? To put it simply, if your stool is greasy and it floats, then you may have a problem with fat absorption. And it's evaluated using a marker called steatocrit. So when steatocrit is elevated, it signals issues with the bile acid absorption or with pancreatic dysfunction. Moving ahead, we also analyze markers like occult blood, which may indicate GI bleeding and warrant further investigation. And in that case, we always refer the patient for colonoscopy because of concerns of colon cancer with occult blood. The next section in the gut test is inflammation and immune function assessment. Inflammation in the gut doesn't always feel like pain, so it doesn't have to be necessarily painful. And here we do measure several markers. We measure calprotectin, a special protein that reflects active inflammation in the colon. Calprotectin is very helpful in distinguishing IBS, that is irritable bowel syndrome, from IBD, that is an inflammatory bowel disease, and that includes ulcerative colitis and Crohn's disease. And unfortunately, high calprotectin may also be seen in colon cancer. So again, if somebody has a high calprotectin, then we do refer this patient for colonoscopy. We also examine secretory IgA, that is the primary immunoglobulin lining the gut mucosa. So this tells us how the immune system is responding to irritants, whether it's hyperactive, suppressed, or imbalanced. So finally, what are the whole body implications of the gut test? So many patients are surprised to learn that gut dysfunction can manifest as fatigue and anxiety, skin problems, joint pain, and hormonal imbalances. So the gut test, which is the stool test, becomes a foundational diagnostic tool helping us map the underlying biological disruptions. So you did the gut test and sat with your functional medicine provider who went over the test. So now, what is the next step? So what do we do with all this information? And this isn't a one-size-fits-all protocol. The findings guide a very personalized therapeutic strategy, and that may include lots of things, actually. It would include antimicrobial, herbal botanicals, probiotics, digestive enzymes, dietary modifications, targeted nutrients, and lifestyle changes. Because we do not want to treat the lab. We want to treat the patient. We want to treat you. So one of the more comprehensive approaches that we often utilize here at Mindful Medical Functional Clinic is the gut intensive program. That's how we call it now clinic, and it's a structured 6-visit program designed to walk patients through the process, and it's done step by step. And just to describe how we do it, and other clinics probably have similar programs. At the first visit, it's a 60-minute consultation, so I deeply review the patient's medical history, symptoms, and prior labs. And we also talk about the levels of stress in their lives, what makes them happy, and what prevents them from feeling good, both emotionally, physically, and in every other way. So we talk about hobbies, and again, emotional and mental health. And it's a fundamental appointment in just understanding another person. Then the stool test kit is shipped to the patient, and they do the stool collection and send it to the lab. So once the results are ready, then we meet with the patient again, and we have another full hour to interpret all this data and to begin the personalized full functional medicine protocol, because there's a lot of data to interpret. And then we move on into a series of follow-up visits where I address usually any questions about medications, because we want to make sure that medications and supplements are compatible. We talk about lifestyle modifications. Diet is a very big thing. And we adjust the plan based on the patient's body response. Our goal, again, not just symptom relief, but a root cause resolution. So if you're interested in enrolling in our gut intensive program and you are a resident of Massachusetts, California, New Hampshire, or Vermont, then you can visit our clinic website. That's in the description of this video to enroll, and that's very straightforward. But if you don't live in these states that I just mentioned above, and you are interested in exploring your gut health, then of course, please seek a functional medicine doctor near you. This is a common test, and it's a fundamental functional medicine test. So I hope you enjoyed this video, and I'm looking forward to your comments. Please don't forget to like, share, subscribe, and hit that notification bell. Thank you so much for watching. Until next time. Bye-bye.